Faria Mahmood suffers from spinal muscular atrophy, or SMA, a rare inherited disease that has ravaged her body and forced her to use a wheelchair since kindergarten.
I can't really reach my arms above my head at this point. Flipping a light switch, now I have to use my left hand to help my right hand.
Without treatment, SMA will make the Maryland college student progressively weaker and could shorten her life.
For me, just even maintaining what I have would be amazing.
At the Johns Hopkins Hospital in Baltimore, she's about to receive a revolutionary new drug called Spinraza. It's injected into her spinal canal. In infants, the drug appears to reverse the disease. In adults, it may keep it from progressing. Mahmood's condition is very uncommon, affecting only about 10,000 people in the United States. And until recently, there was no treatment. Spinraza is sold by Cambridge pharmaceutical company Biogen. It is, by most measures, a miracle drug. But there's a big hitch: the price. The first year's 6 doses cost a staggering $750,000, and 3 doses every year thereafter cost $375,000. This vial alone costs $125,000.
Insurance does not want to cover it because they know how much it's going to cost.
Mahmood receives the drug free through a program set up by the drug company. But not everyone has been so lucky.
We have a waiting list of about 80 people from throughout the U.S., internationally. People are really desperate.
Bryn Willis coordinates Spinraza injections for Johns Hopkins. The high price has forced hospitals and insurers to make difficult decisions about who gets and does not get the drug. Willis herself has the disease, but has not received Spinraza. Of roughly 10,000 SMA patients in the United States, only about 1,400 have received it so far.
I've had quite a few of the parents and caregivers cry on the phone. I mean, you're talking about somebody on the other phone who's probably called 8 other institutions saying no.
All of us were surprised that the price was so high. We didn't expect it to be so high.
Dr. Basil Darras, a neurologist who led the clinical trials of Spinraza at Boston Children's Hospital, says the price has limited the drug's availability. Some hospitals have to buy the drug up front before they know whether they'll be reimbursed.
It has probably slowed down things to some extent because of the fact that some hospitals probably didn't want to take the risk.
The price has alarmed hospitals that buy Spinraza up front and health insurers that decide whether to pay for it. That makes it difficult for patients to know whether they can get it.
It wasn't very clear what was going to be covered, what wasn't.
Ben Gableman travels to Mass General Hospital from Atlanta to receive his Spinraza injections.
So Ben, you'll probably feel a little bit when we get down there. You let me know if it's too uncomfortable.
It took him 6 months of phone calls to get his insurer and Biogen to cover it.
For the past 6 months, I've just been kind of putting all my entire financial life on hold. I was going to buy a condo, I didn't. It's pretty frustrating. I don't understand how it costs that much.
So why does it cost that much? How did we end up with a miracle drug that almost no individual can afford? Unlike other developed countries, which set the prices of medicines, the United States does not regulate prescription drug costs. Drug companies can charge whatever the market will bear. Many treatments for more common diseases have already been developed, pushing the biotech industry to increasingly focus on rare diseases. There are about 7,000 so-called orphan diseases, each of which affects fewer than 200,000 Americans. To date, only about 5% of these rare conditions have treatments. All told, these diseases affect 1 in 10 Americans. Biotech companies say simple math is the reason that drugs for orphan diseases are so expensive. A Tufts Research Center estimates it can cost over $2.5 billion to develop a drug and bring it to market. To recoup that cost, companies say they must charge considerably more for a drug that treats relatively few patients with a rare disease, like SMA, than they would for one that treats millions, like statin drugs for high cholesterol. Critics say drug companies exaggerate how much it costs to bring medicines to market. Research often begins in taxpayer-funded universities or labs, but most experts do agree that development of these drugs is risky and expensive.
Biogen did a spectacular job. We needed them. This was unbelievably expensive to make this.
Dr. Thomas Crawford is a veteran neurologist at Johns Hopkins.
Their financial people said that, well, in order for us to make the money back, we're going to have to price it this way. That kind of pisses me off, but I also realize the real world, that's the way it works. So I see no villainy in that.
Spinraza can completely reverse SMA in infants, but insurers are hesitant to cover the drug for adults who may only gain modest benefits.
Although insurance companies may not view that as highly significant difference, when you don't give them the opportunity to have access to these drugs, you're questioning someone's life.
The strain of Spinraza on the health system is the downside of remarkable scientific progress, and it may be a sign of things to come.
This era of personalized medicine that sounds wonderful on the one hand is also extraordinarily expensive on the other. So how, as we as society, we're going to pay for that? I don't have an answer to that question.